Welcome to Mental Health Mini number 6, Stress and Grief. There's two different types of stress, eustress and distress. Eustress is a normal stress response and often benefits the individual by either motivating them to do something or protecting them by preventing them from doing something that may be harmful to them. During a normal stress response, we see a release of adrenaline and cortisol. And sometimes, if it's a protective measure, we also see a fight or flight response. And this is when our sympathetic nervous system is activated, releasing adrenaline and norepinephrine. In the stress responses, we see increased heart rate, increased blood pressure, increased respirations, muscle tone, alertness, arousal, and pupil dilation. This is a protective mechanism to allow us to either flee or think through a situation that may be harmful so that we can protect our safety. During this time, we also see a decrease in GI functioning. Distress, however, is a type of stress that we experience when we have extreme anxiety, sorrow, and pain, and it's beyond what is normal and beneficial to the individual. Distress is maladaptive and it can lead to negative health consequences. One type of approach that we look at in determining eustress versus distress is the general adaptation syndrome. The first thing that happens with the general adaptation syndrome is our body recognizes a threat to its physical or psychological safety. That causes an alarm reaction as our stress resistance increases. This is an uncomfortable feeling for an individual, so they start to implement coping skills. And this is when we enter the resistance stage. If those coping skills do not work, it may be trial and error, it may be deliberative, but if they don't work, then our body reaches a state of exhaustion. So that's one way that we can look at how people are responding to stress and how stress can lead to exhaustion. The effects of stress may be physical or psychosocial. Physically, we see that people that experience chronic stress have more pain, cardiac arrhythmias, sleep changes, headaches, hypertension, increased muscle tension, increased jaw stiffness and pain, a weakened immune system, poor glucose regulation, increased nausea and vomiting, infertility, appetite changes, increased risk of cancer and cardiovascular disease, and increased allostatic load, which is the wear and tear on our body over time due to stress. From a psychosocial perspective, we see increased anxiety and depression, increased substance abuse, decreased libido, decreased memory, focus, and attention, social isolation, decreased productivity, avolition, which means lack of motivation, and restlessness. One way that we handle stress is through coping and adaptation. Adaptation is the capacity to thrive and flourish in a stressful or challenging situation, either physically or emotionally. And the purpose of coping is to help us to manage the emotional response to stress and to reach a state of adaptation. Coping is deliberate, planned, and psychological effort to reduce stress, and it's going to vary based on the situation and the individual. There's two different approaches to coping. There's problem-focused and emotion-focused. Problem-focused is identifying the cause of distress and eliminating that cause. This is going to be the most effective coping strategy because it eliminates the cause of stress. If it's a situation where the elimination cannot happen or we cannot identify the cause of stress, then we move to emotion-focused coping, and this is dealing with the effects of stress. We categorize our coping skills into two groups, adaptive or maladaptive. Adaptive coping helps us to deal with our stress and reduce it, whereas maladaptive is coping strategies that we use to try and reduce our stress, but may be harmful for our body. Examples of maladaptive coping skills would be things like turning to alcohol, cigarette smoke. In certain situations, other coping skills may be maladaptive where they're adaptive to others. So in someone with an eating disorder, exercise may be maladaptive because their body doesn't have the caloric capacity to sustain the energy exertion. Whereas in an individual without an eating disorder, exercise may be a very adaptive and effective coping skill. So on the right, there's a list of different coping skills. You can see it's very diverse, and it can really be anything that's going to help that individual feel less stressed. One form of stress is grief. Grief is a response to loss, and that loss may be an actual loss, a perceived loss, an anticipated loss. It could be loss of a relationship, loss of an individual, loss of a job, loss of something that was important to that individual. And there's different stages of grief. Anticipatory grief is when you kind of know that a loss is coming. If you have a family member that's really sick and they're starting on hospice, they haven't died yet, but you know that they're going to, you start the anticipatory grieving process. This can be beneficial in the sense that it helps us to start the grieving process early, and it often results in a shorter and less intense grieving process. The downside to anticipatory grief is that it can really inhibit our ability to enjoy that loss before it becomes an actual loss. Prolonged grief is grief that occurs longer than what we would typically expect. It's often more severe and typically needs more treatment to treat rather than a normal grieving process. A delayed or inhibitive grief response is when the grief doesn't occur right away after the loss, but rather occurs later down the line, or when when the individual is not allowing them to feel the grief as much as they should. Then we have distorted grief, which is where the grieving process causes abnormal thought processes and often needs intervention. And then we have a concept called bereavement overload. And bereavement overload occurs when you have multiple losses at one time. And bereavement is the process of dealing with grief. So the more that you're grieving, the more difficult it's going to be to get over those griefs, and it can cause a cumulative effect. One model that we look at for how to get over grief and how to focus on bereavement is the tear analogy. So the process of bereavement is to accept the reality of the loss, to experience the pain of the loss, to adjust to a new life without that person or whatever was lost, whether it be a job, a person, whatever, and then to reinvest in a new reality. And there's a couple of different models for how people work through bereavement and grief. The first one is the Kubler-Ross grief cycle. And this is a very commonly accepted approach to grieving, and it goes through 5 different stages. The individual can go back and forth between the different phases and doesn't necessarily follow them in a particular order. But typically what we see is at the initial start of the loss, the person's in a state of denial. They may avoid the situation, they may be confused, elated, still in shock or in fear. Then they move to the anger level where they may experience frustration, irritation, and anxiety. And during the denial and anger phase, the main nursing responsibility is to inform the patient and communicate effectively. And then they enter the bargaining stage where they struggle to find meaning with the loss, so they try to bargain back and forth. They reach out to others. They're often telling their story of grief, and at this time, our nursing responsibility is emotional support. After bargaining, they may reach a state of depression where they feel overwhelmed, helpless, hostile, and they may try and avoid and flee the situation. And then lastly, we have acceptance, where they've accepted the loss, they are in a new place, they've adapted, and they move on from that pain. It doesn't mean that they don't still value what they lost, but they've found a way to move past it. And during this time, our nursing intervention is guidance and direction. And then we have our dual processing model of coping. And basically what this says is there's 2 different types of coping through a loss. There's loss-oriented coping and there's restoration-oriented coping. The loss-oriented coping focuses on the loss, and it's a lot of the intrusion of grief. It's the grief work, trying to break your ties emotionally and mentally with whatever you lost, and it may involve denial and avoidance. Whereas the restoration-oriented coping is trying to find ways to adapt to new life, doing new things to distract from the grief, or you may be in denial of the grief, and to form new roles and relationships. And the dual process model of coping essentially shows that you're going to bounce back and forth between restoration-oriented coping and loss-oriented coping until you reach a place where you have coped with that loss. And that is our models of grief, stress, and coping.